Okay, hello to all of you. Let's discuss chapter number 20th. And chapter number 20th is basically about the infectious diseases affecting gastrointestinal tract. And again, this information is all very straightforward. So I'm going to go over some of the important things with you. Let's go. So basically, first of all, we are going to talk about acute diarrhea and then we're going to talk about chronic diarrhea. So basically, what is acute diarrhea? 3 or more loose stools in 24-hour period is called acute diarrhea. On average, citizens of US experience 1.2 to 1.9 cases of diarrhea per person per year, and children experience double the rate of adults. And it basically involves the diarrhea is accompanied by fever, abdominal pain, cramping, nausea, vomiting, and dehydration. In US, up to 1/3 cases of acute diarrhea is transmitted by contaminated food. And so E. coli, this strain, is involved in the acute diarrhea. So basically, the gram-negative enteric bacteria are named and designated according to the following antigens. So as I just showed you, this kind of the strain of E. coli, it has O157H7. What does it mean basically? What does O and H mean? So they are these different antigens. H is the flagellar antigen, K is the capsular antigen, and O is the cell wall antigen. Okay, the very first organism, bacteria we are going to talk about is Salmonella. So basically, the rate of Salmonella infection is about 10%. Okay, and this is the most important strain of Salmonella which causes these infections called Salmonella typhi. These are some of the characteristics of Salmonella. These are some of the biochemical characteristics. So basically, this is the not a biochemical character. So Salmonella are motile organisms. This is the biochemical character. They ferment glucose with acid and sometimes gas production. They produce hydrogen sulfide. They grow readily on the laboratory media. And so severe form of salmonellosis include elevated body temperatures and septicemia. Septicemia is when the microorganism is growing in the blood, is multiplying in the blood. That condition is called septicemia. In the severe form of the salmonella infection, there is elevated temperature and septicemia, and in the milder form of salmonella infection, there is a vomiting, diarrhea, mucosal irritation. There can be blood can appear in the stool. And the most important virulent factor for Salmonella is an endotoxin. So the prevention and treatment, the prevention is basically avoiding contact with the bacterium. And the uncomplicated cases can be treated with fluid and electrolyte replacement. Next is Shigella. So they are basically, these are some of these characteristics. They are gram-negative rods, non-motile, non-endospore forming. They do not produce these enzymes urease and hydrogen sulfide. And basically, Shigella causes watery stools, fever, intense abdominal pain, nausea and vomiting are common, and they also called dysentery. So what is dysentery? Dysentery is diarrhea containing blood. So in Shigella, stools often contain obvious blood and even more found to have occult blood. And basically, the virulence factor in Shigella is release of endotoxin, which causes fever. Then there is an enterotoxin, which affects the GI tract, damages the mucosa and villi, and also it produces Shiga toxin. It is responsible for serious damage to the intestine and the systemic effects. So I'm just going to skip all these things. You can go over them, how to prevent and how to treat. So basically, in the treatment is usually the name of some of the antibiotics. Next, we're going to talk about E. coli, Escherichia coli, and this one is called Shiga toxin producing E. coli. So this is the strain of the E. coli, which is very virulent, and it is generally referred to as Shiga toxin producing E. coli. So E. coli O157H7 and its close relatives are the most virulent of them all, and they're generally referred to as Shiga toxin producing E. coli. And it produces symptoms like mild gastroenteritis with fever to bloody diarrhea. Minority of patients develop hemolytic uremic syndrome and severe hemolytic anemia that can cause kidney damage and failure. So the virulent factor of this kind of bacteria is basically due to Shiga toxins, and this toxin is identical to Shiga exotoxin secreted by virulent Shiga species. And the Shiga toxin genes, they are present on the prophage genes donated by the macrophage in the E. coli. And these are other strains of E. coli, at least 5 other categories of E. coli which can cause diarrheal diseases. They are enterotoxigenic E. coli, enteroinvasive E. coli, enteropathogenic E. coli, then diffusely adherent E. coli, enteroaggregative E. coli. Okay, the next bacteria which is responsible for diarrhea is called Campylobacter, one of the most common bacterial cause of diarrhea in US, Campylobacter. And the symptoms are watery stools, fever, vomiting, headaches, and abdominal pain. And Campylobacter jejuni is the most common cause. And these are some of its characteristics. They are slender, curved, gram-negative bacteria. They have polar flagella at one or both poles. Yeah. So once ingested, Campylobacter jejuni cells, they reach mucosa at the last segment of the small intestine near its junction with the colon. They adhere, burrow through the mucus, and multiply. And what is the virulent factor? It's a heat labile enterotoxin, which stimulates secretory diarrhea, similar to cholera. And this is basically how to treat it. So it's usually simple non-specific rehydration and electrolyte balance therapy. These are some of the antibiotics. Next is Clostridium difficile. This is a gram-positive endospore-forming rod, and this causes pseudomembranous colitis. And this is basically so this is an antibiotic associated colitis. This is precipitated by therapy with broad spectrum antibiotics such as ampicillin, clindamycin, or cephalosporins. So this bacteria is able to superinfect the large intestine when drugs have disrupted the normal biota. And this bacteria, it produces two kinds of toxins, toxin A and B, and it causes areas of necrosis in the walls of the intestine. And these symptoms are cramps, fever, leukocytosis, colon is inflamed, generally sloughs off loose membrane membrane patches like pseudomembranes consisting of fibrin and cells. Okay, so this basically talks about some of the antibiotics. Next is Vibrio cholerae. So we also have done a case study on the cholera, so you know a lot of things about it. So Vibrios, they are rod with single polar flagellum, and the shape is like a comma of this bacteria. They basically ferment and grow on ordinary and selective media containing bile at 37 degrees centigrade. They possess unique O and H antigens. There are two major kinds, classic and Altor type. So incubation period is few hours to few days. Abrupt symptoms of vomiting followed by copious watery feces called excretory diarrhea. Contains flack of mucus as described as rice water stool. Diarrhea causes loss of blood volume, acidosis from bicarbonate loss, and potassium depletion, causing muscle cramps, severe thirst, flaccid skin, sunken eyes, and in young children, coma and convulsions. Other consequences of this disease, of this Vibrio cholerae, is hypotension, tachycardia, cyanosis. And basically, the infectious dose is 10 to the power 8 cells of this bacteria. So Vibrio penetrate the mucosal barrier at the junction of duodenum and jejunum using their flagellum. And the virulence factor is because of an enterotoxin called cholera toxin. It disrupts the normal physiology of the intestinal cells. Cells shed large amounts of electrolytes into the intestine accompanied by profuse water loss. So this is all general information. I'm going to skip. Next is Cryptosporidium. So this is a protozoa. So intestinal protozoa of epicomplexan type, and basically its symptoms are just like the symptoms of gastroenteritis, which involves headache, sweating, vomiting, severe abdominal cramps, and diarrhea. So they can be detected by ELISA or acid-fast staining. So this talks about the treatment. Antidiarrheal drugs may be used. Next is a virus, rotavirus. It is a member of reovirus family, and they have double-stranded RNA genome with the inner and outer capsid. So you need to go back and think about, I think, chapter number 5, where we discuss the structure of virus. So this is a double-stranded RNA genome virus. So the transmission is by fecal oral route. The symptoms are watery diarrhea, fever, vomiting, dehydration, and shock. Next is norovirus, second most common cause of US hospitalizations from foodborne diseases. Transmission is fecal oral route. Symptoms involve profuse watery diarrhea for 3 to 5 days, vomiting and fever. Treatment is rehydration. Next, we are going to talk about food poisoning. In this, patient presents with severe nausea and vomiting accompanied by diarrhea. And these are some of the causative agents of food poisoning, which involve Staphylococcus aureus, Bacillus cereus, and Clostridium perfringens. So this is Staph aureus. It produces exotoxin. And toxins produced by multiplying bacteria do not noticeably alter the food's taste or smell. The exotoxin, which is an enterotoxin, so this is the toxin which is produced by this bacteria, is heat stable. Inactivation requires 100 degrees Celsius for at least 30 minutes because it's a heat stable toxin. So ingested toxin acts on gastrointestinal epithelium. It stimulates nerves, causing symptoms of cramping, nausea, vomiting, and diarrhea. So next is Bacillus cereus. It produces exotoxin. So this is a sporulating gram-positive bacteria. It's a common resident in vegetables and other products. So it produces two exotoxins. One causes diarrheal type disease, other causes emetic or vomiting disease. So the diarrheal form of disease, so usually associated with cooked meats, vegetables held at warm temperature for a long period of time. These conditions favor the production of high molecular weight heat labile exotoxin, watery profuse diarrhea that lasts for about 24 hours. Clostridium perfringens, this is also a causative agent of the food poisoning, and it also produces a exotoxin. So it's a gram-positive sporulating bacteria. So when foods are cooled, endospores germinate and cells multiply, especially when food is not refrigerated. So if the food is eaten without adequate reheating, then this bacteria can enter the intestine and release exotoxin, and toxin acts on epithelial cells and initiates acute abdominal pain, diarrhea, and nausea. And C. perfringens, Clostridium perfringens also causes enterocolitis infection. So now we're going to talk about chronic diarrhea. Now what is chronic diarrhea? Chronic diarrhea means when the diarrhea lasts for longer than 14 days. Okay, and people suffering from AIDS suffer from chronic diarrhea caused by opportunistic microorganisms like Cryptosporidium and Mycobacterium avium. And this is the strain of E. coli, enteroaggregative E. coli, which is associated with the chronic disease, especially in the children. It's distinguished by its ability to adhere to human cells in aggregates rather than as single cells. Then Cyclospora catianensis protozoa, sorry, it's a little complicated name. So this is a protozoa which is responsible for the diarrhea. Most cases, the transmission is fecal oral transmission. Most cases associated with the consumption of fresh produce and water contaminated with feces. Next is Giardia lamblia. So it's a pathogenic flagellated protozoa. It's the most common flagellate which is associated with clinical specimens. We're going to talk about its structure. It has unique symmetrical heart-shaped morphology. Its organelles are positioned in a way that it resembles like a face. It has 4 pairs of flagellum emerge from the ventral surface. Ventral surface is concave and acts like a suction cup. Giardia cysts are small, compact, and contain 4 nuclei. So it causes diarrhea of long duration, abdominal pain and flatulence. Stools have greasy, foul-smelling quality to them. So this is the morphology of the Giardia. This is the cyst of Giardia. You can see it has 4 nuclei. And this is the trophozoid. So it has the 4 pairs of these. They have 4 pairs of the flagellums, and you can see how it's like a heart shaped. So it has 4 pairs of flagellum emerge from the ventral surface. So the organelles are positioned in a way that it resembles like a face. You can see how the organelles, so these are the 4 pairs of flagellum, and how the organelles are arranged that it gives a shape of a face. So both trophozoites and cysts escape in the stool, but cysts play a greater role in transmission. Giardia cysts can survive for 2 months in the environment. Cysts are usually ingested with water and food and swallowed after close contact with the infected people or contaminated objects. Infectious dose is around 10 to 100 cysts. Now is entamoeba, and we are going to talk about entamoeba histolytica, and this is responsible for causing dysentery. So dysentery is when in the stools there is a blood. Simple life cycle alternates between large trophozoid and the small non-motile cyst. So trophozoid motile by means of pseudopods. So pseudopods are like pseudo word means falls, pods means foot. So this amoeba basically extends its surface and it gives appearance of a kind of a false foot, and they move by those false foot. So these trophozoites, they lack most of the organelles, has a large single nucleus that contains a prominent nucleolus called karyosome. So this is the karyosome. Okay, so this is the nucleus. In the nucleus has a large single nucleus that contains a prominent nucleolus called karyosome. So this is the karyosome. So this is the trophozoite, and this is the cyst. So the cyst contains 4 nuclei with 4 cigar-shaped chromatoidal bodies, which are dense clusters of ribosomes. So in the cyst there are chromatoidal bodies which are dense clusters of ribosomes. So this is trophozoite, this is the mature cyst. So these are the initial targets: cecum, appendix, colon, and rectum. Amoeba secretes enzymes that dissolve tissues, actively penetrating deeper layers of mucosa and leaving ulcerations. So this phase is marked by dysentery, which is the presence of blood in the stool, abdominal pain, fever, diarrhea, and weight loss. So life-threatening manifestations include hemorrhage, perforations, appendicitis, and tumor-like growths called amoebomas. Amoebomas. Sorry, little complicated word. Okay. These amoeba, they can even go to lungs. Pulmonary amoebiosis is rare. Most common site of invasion is basically for this amoeba is liver. Abscesses containing necrotic tissue and trophozoites develop and cause amoebic hepatitis in the liver. Other infrequent targets are spleens, adrenals, kidneys, skin, and brain. Okay, next is gastritis and gastric ulcers, and the causative agent is a bacterium called Helicobacter pylori. So they are basically curved gram-negative rods. So these are the name of the scientists who actually isolated this microbe in culture, and they proved that this microbe causes gastric ulcers. So and Helicobacter pylori, it causes gastritis, it causes ulcers. It is also responsible for causing cancer. So fifth most common cancer in the world is stomach cancer, and evidence suggests that long-term Helicobacter pylori infection is a major contributing factor to the stomach cancer. So this basically talks about how does this bacteria causes the infection. So once the bacterium passes into the gastrointestinal tract, bores through the outermost mucosal layer that lines the stomach epithelium, attaches to specific binding sites on the cells, produces an enzyme called urease that breaks down urea in the vicinity to form carbon dioxide and ammonia. And the last one is hepatitis, which is the inflammatory disease marked by necrosis of hepatocytes and inflammatory response that swells and disrupts the liver architecture. and it can be caused by hepatitis, which is the inflammation of hepatocytes, which are the liver cells. It can be caused by these different kind of microorganisms, which involve cytomegalovirus, Epstein-Barr virus. So this is basically, these are all different viruses. Then hepatitis viruses A through E. And there can be some non-infectious conditions which can also cause the inflammation of the hepatocytes, which can include autoimmune diseases, drugs, or the alcohol abuse. So this is all in chapter number 20th. If you have any question, please let me know.